Okay, today we're picking up on Section 2, Mold and Health, Dirty Moldy Fiberglass Duct Liner in AC Supply Plenum. It's a major cause of occupant irritation. Objectives of Section 2. In Section 2, we explain the health effects of mold. At the conclusion of Section 2, you'll be able to describe the major respiratory health concerns regarding indoor mold growth. Describe the major neurological health concerns regarding indoor mold growth. Explain the involvement of the HVAC system to mold illness. And explain why gases are given off by mold and how these gases can impact health. Why study the health effects of mold? Question: what does studying the health effects of mold have to do with mold assessment? Your answer: if people feel ill when they are living, studying, or working in a building that has water damage or problems with the air conditioning system or ducting, but there is no visible mold, that may be an indicator of a hidden mold problem. You need to know what these mold illness symptoms are because they're often much more reliable indicators of mold problems than testing for hidden mold. We study the health effects of mold to understand how mold growth could be affecting occupant health before remediation, identifying if there is a mold problem, defining how serious the problem is. Similarly, we study the health effects of mold to understand if the property after remediation is ready for reoccupancy by mold sensitive individuals, or if there's hidden mold or improper mold remediation causing mold related health problems. This right here shows mold growth in a linen closet due to leaking AC coolant line in the adjacent closet. Hidden mold inside walls was much more extensive than the visible mold. The most common routes of exposure: inhalation, breathing mold contaminated air; skin, sitting on mold contaminated furniture; and ingestion, eating mold contaminated food. Sensitization: when there's a mold problem and people are exposed to higher levels of indoor mold, some people become sensitized, more sensitive to mold. Even if mold remediation work brings the levels back down to where they were before, occupants may complain of mold related ailments. This can be real and not hypochondria. What are these ailments? Ailments from mold are diverse. Ailments from mold problems and from bad mold remediation work can be diverse, including neurological disorders, respiratory problems, and others, like headaches, short-term memory loss, asthma-like symptoms, sinus problems, skin rashes, intestinal disorders, chemical sensitivity, organ transplant complications, and others. Published by the Surgeon General. Neurological problems are problems that affect the brain. Dr. Rosen's book, Environmentally Friendly Mold Remediation Techniques, Chapter 2, reviews recently declassified U.S. Army research published by the U.S. Surgeon General that mold neurotoxins have been used in biowarfare. The U.S. Army research includes studies of human subjects showing that neurological disorders from exposure to biowarfare agents made from mold toxins correlate with common neurological disorders we see in mold sensitive people. occupying sick buildings. Neurological disorders. While the majority of the medical establishment rejects claims that elevated indoor mold results in any neurological problems, virtually everyone in the mold business knows that headaches are one of the most common ailments found in people working or living in buildings sick from mold contamination. Headaches are neurological by definition. In this picture right here, it shows water leaking into a wall under improperly installed window, resulting in heavy mold inside of the insulated wall. Other neurological problems, often found particularly in children occupying sick buildings, including both schools and homes, are behavioral and sleep disorders, light sensitivity, and especially the inability to concentrate and lack of short-term memory. Research shows that early exposure to elevated mold cause or exacerbate attention deficit disorder. When insulation in a wall gets wet, you always get mold growth because the wall is very slow to dry out. Headaches and such. Scientific studies that prove mold causes these neurological problems are lacking. However, mold toxin binding therapy that flushes mold toxins from the system is often very successful at reducing or even eliminating many childhood and adult neurological disorders from mold toxins. We feel that if you can reduce or eliminate such disorders with mold toxin binders, that goes a long way to proving the problems originated from mold toxins. Electron micrograph of mold in this picture right here. There are many kinds of indoor mold with hundreds of or thousands of toxins and irritants. Proving mold health effects. Understand that while we all know that smoking causes cancer, this was never actually scientifically proven. The health problems from smoking became established fact on the basis of years of clinical evidence by leading medical doctors, not due to scientific, which means laboratory proof. We believe the same will be true with neurological problems from mold. Our advice is to consider the possibility of mold if people complain about headaches or other neurological problems when they occupy indoor spaces that are or have been water damaged. In this picture right here, I want you to notice how different this mold looks compared to the mold on the previous page. Mold varies enormously from species to species, and so do the toxins and allergens that they produce. Toxin binding treatments. Mold remediation contractors often take the prescription drug cholestyramine, Questron, to help eliminate mold toxins from the body. It is an FDA-approved treatment for lowering cholesterol and is also used as a toxin binder to eliminate toxins from the gut. Please note that drug treatments for mold-related problems do not work if the individual remains in a mold-contaminated location. Respiratory problems. Respiratory symptoms from mold exposure are the most common problems from mold exposure. The U.S. EPA has performed extensive research into mold, water damage, and child respiratory health. Respiratory problems. The latest government U.S. EPA research shows mold problems can cause childhood asthma and that proper remediation can reduce asthma symptoms by tenfold. See the table below. A summary of this work performed by the U.S. EPA and funded by the National Institute of Health can be found on the next page. EPA research on respiratory problems. Moldy homes with children living in them were studied. Dust in these homes were analyzed by mold DNA profiling. There was an 80% likelihood of finding an asthmatic child in a home with mold problems. Furthermore, successful remediation of the mold in these homes significantly to 90% reduced the asthmatic child's need for hospital admissions during the follow-up. These are unbelievably powerful findings. Mold can cause childhood asthma, and proper remediation can dramatically reduce asthma attacks. This picture right here shows a hole at the top of an AC closet, allowing the air handler to pull moldy attic air into the AC closet. ERMI mold testing. The DNA-based mold testing discussed in the previous slide has been licensed from the EPA by many mold testing labs. The procedure is called ERMI, the EPA Relative Moldiness Index. Explaining ERMI testing is beyond the scope of this course. Whereas air sampling test the indoor air at that time for the mold spores, ERMI screens for mold spores and fragments in carpet or floor dust and provides a history of mold problems in the home or office. Note that there are many limitations to ERMI sampling. A detailed write-up on ERMI limitations can be found at www.mold/toxins.com. ERMI mold testing and mold toxins. ERMI, to a large degree, has replaced viable mold culture testing as a method of identifying the species in addition to the genus of mold. Air and surface sampling for mold spores can give you the genus of some of molds, but not the species. Example is Aspergillus niger. Genus comes first, then species. More on naming conventions is found at wikipedia.com, and then you type in binomial nomenclature. It is generally necessary to know both the genus and the species of a mold to determine if it's a toxin producer, and if it is a toxin producer, the type of mold toxin that can be produced. You could see an example on Wikipedia under Aspergillus niger. Potential health effects. We've touched on neurological and respiratory problems from mold exposure that can affect mold-sensitive people. There are actually quite a few potential health effects from mold toxins and allergens, such as allergic reactions, fungal sinusitis, disease and infections, toxic effects, and gut-related problems. And this picture right here shows Aspergillus mold, which is a common outdoor mold also found inside water-damaged structures. Antibodies and allergic responses. About 10% of the population has allergic antibodies to fungal allergens. Half of those, about 5%, would be expected to show allergic responses. In this picture right here, we're showing dirty, moldy fiberglass duct liner in an AC supply plenum, often the cause of allergic reactions. Common allergic reactions. Allergic responses are most commonly experienced as allergic asthma, allergic rhinitis, which is hay fever, allergic fungal sinusitis, and in this picture right here, we're showing fiberglass lined AC plenum that was cleaned, sealed, and then encapsulated, painted with protective coating and sealant. Now perfect. No more allergic reactions. Timing of allergic reactions. Allergic reactions can be immediate or delayed. Reactions can result from inhaling or touching mold or mold spores. Mold spores and fragments, whether they're dead or alive, can produce allergic reactions in sensitive individuals. Repeated or single exposure may cause previously non-sensitive individuals to become sensitive, such as mold on furniture. Asthma. Molds can trigger asthma attacks in persons allergic, sensitized to molds. And this picture right here is showing after mold-filled air handler was removed, cleaning, sealing, and encapsulating plenum, it was like new. Hay fever-like symptoms. Hay fever type symptoms include sneezing, runny nose, red eyes, skin rash, dermatitis. And in this picture right here is showing reinstalling an air handler after acid washing the components. Sinusitis. Acute sinusitis lasts a month or less. Condition is usually a bacterial infection. Chronic sinusitis lasts 3 months or longer. Chronic sinusitis is one of the most commonly diagnosed chronic illnesses in the United States, affecting 30 million to 40 million Americans each year. Chronic sinusitis is often fungal-based. Mold as a cause of sinusitis. Fungal sinusitis and other health problems can be prevalent in mold workers and people who live, work, or go to school in moldy, musty-smelling, or water-damaged buildings. Health food stores generally have knowledge of how to avoid and or treat sinus ailments due to fungal overgrowth with products such as yeast fighters, which fights yeast and mold, and probiotics. For more information on probiotics, see http://nccam.nih.gov/health/probiotics. Treatments for mold-related problems do not work if the individual is constantly exposed to mold. Exposure levels must be reduced. Overuse of antibiotics as a cause of fungal sinusitis. It is our observation that many times fungal-based chronic sinusitis is a result of excessive use of antibiotics that strip the sinuses of good bacteria, which when present help protect sinuses from colonization by fungi, yeast and mold. Similarly, overuse of antibiotics results in the digestive system being stripped of good bacteria, with resulting yeast overgrowth that causes reduced immune system function and digestive problems. The signs and symptoms of chronic sinusitis include facial pain and pressure, especially in the forehead, temples, cheeks, nose, and behind the eyes, difficulty breathing through the nose, drainage of a thick, yellow, or greenish discharge from the nose or down the back of the throat, reduced sense of smell or taste, nasal obstruction or congestion, aching in your upper jaw and teeth, headache and teeth pain, bad breath, called halitosis, ear pain, fatigue, cough, nausea, and sore throat. Mold as a cause of sinusitis. Chronic sinusitis is often due to an inflammatory reaction to certain types of airborne fungi. When you see the term airborne fungi, the first thing that should come to the mind is mold problems with the AC. Cause of mold illness. Mold on fiberglass-lined duct insulation and plenums is, in our experience, the #1 cause of mold-related illness. Susceptible persons include children, asthmatics, the elderly, immune-compromised, and those heavily treated with antibiotics or other ailments such as sinus infections and adolescent acne. Special attention must always be given to inspecting the AC and ducting for problems when occupants complain about mold-related illness. Airborne mold. White mold on fiberglass insulation in AC supply plenum. The yellow arrow shows it right here. Mold growing on AC insulation is dispersed into the air 24/7. Fungal infection. Opportunistic fungal infections are of great concern to people who are immune compromised or immune suppressed, such as those with HIV or receiving cancer chemotherapy. An example of aspergillosis, where mold actually grows inside of the lungs. Again, make sure there is no mold growing on fiberglass linings of air conveyance systems. Organ transplants. Opportunistic mycosis can cause significant complications in organ transplant recipients. The incidence of invasive fungal infections vary from 2 to 14% in renal transplant recipients to higher rates ranging from 7 to 42% in liver, 15 to 35% in lung and heart and lung, and 40 to 49% in small bowel transplant recipients. The vast majority of these infections are due to Candida, 35 to 91%, or Aspergillus, 9 to 52% species. And this picture right here shows opening the attic behind the AC supply plenum, allowing mold spores to be pulled from the attic into the building, resulting in occupant irritation. Respiratory infections. Several serious fungal respiratory infections that can affect healthy people can be caused by a few pathogenic fungi. They are not typically encountered indoors, such as cryptococcus associated with bird droppings and histoplasma associated with bat droppings. Workers cleaning very dirty areas, such as attics where birds or bats have roosted, could be a risk if not adequately protected. This picture right here shows that only disinfectants safe for household use are recommended. Mycotoxins. Mycotoxins can be on the surface of mold spores or in the mold stalks or mold fragments. Over 200 mycotoxins have been identified from common indoor molds. Mycotoxins are not inactivated, killed by typical disinfectants used to kill mold or bacteria. Mycotoxins have to be removed either by cleaning or by disintegration with strong bleach. Health effects of mycotoxins. Adverse health effects from the ingestion of mycotoxins found on moldy foods have been extensively studied and are well accepted. Liver damage, nervous system damage, and immunological effects. Adverse health effects of mold from inhalation exposure to mycotoxins have been less well studied. And in this picture right here shows mold on fiberglass in an AC supply plenum in a brand new school, which turns out that everyone was sick. Common toxigenic molds. Certain types of mold, Stachybotrys, which is a toxic mold, Aspergillus, Penicillium, and Chaetonomon, all commonly found in Florida water-damaged buildings and are known to produce harmful mycotoxins in addition to producing irritants. In this picture right here, it shows moist air leaking from an attic into the ceiling, causing mold in a nursing home. Microbial, volatile, organic compounds. MVOCs are gases produced by growing molds and released into the air as a byproduct of mold growth. They often have strong and/or unpleasant odors. Health effect research in early stages. Exposure possibly linked to symptoms such as headaches, nasal irritation, dizziness, fatigue, and nausea. MVOCs go away when the mold is removed or killed, or goes latent due to a lack of moisture. And this picture right here shows mold on a bathroom wall of a building under construction as a result of inadequate ventilation. Microbial, volatile, organic compounds. MVOCs are gases given off by growing molds. They are not detected by mold sampling. Active mold equals a musty smell. All of you have experienced active mold and mold odors firsthand. Remember going into a bank office, remember going into a bank or an office or a home or a movie theater in the summer and it smells musty? Well, that's growing mold. Only growing active mold produces the gases, MVOCs, that are what you smell. You don't actually smell the mold itself. Health problems may temporarily go away when hidden mold is dormant in the winter and mold is not producing gases. And this picture right here is showing a battery-operated spore sampling pump with built-in calibration. At the yellow arrow, MVOCs are not sampled with spore traps. Your blue arrow up here, which is pointing to air sampling, spore trap cartridge. Dormant mold equals no musty smell. Generally, the mold smells go away in the drier months when mold goes dormant, but the mold is still there. Mold testing during dry months will often miss this source of hidden mold because the mold is dormant when humidity is below 65% and new spores are not being produced. Again, dormant mold does not produce the gases that smell, nor does it produce new supplies of mold spores, which are detectable by air sampling. Health problems from mold may go away when mold is dormant. In this picture right here, it shows a mold-contaminated fiberglass lined air duct, which is a very common and very serious health hazard. Humidity and indoor illness. The chart above shows the effect that humidity has on growth of indoor fungi as well as bacteria, viruses, and mites as well. The chart shows that indoor humidity in the range of 45% to 55% is ideal for minimizing allergies, asthma, respiratory infections from all sources. Humidity and mold growth. Once mold starts to grow from a water leak or from moisture on a wet, condensing, cool surface, all it takes is humidity to keep it active. Below about 65% humidity, which is the yellow arrow, mold will no longer be active. It goes dormant and does not produce spores or MVOCs in the absence of a water source. Keeping humidity under 55%, such as the blue arrow shows, eliminates dust mite growth. Personal factors and hygiene. Personal factors can influence the effects of exposure to hazardous substances, such as smoking and/or alcohol consumption, medication use, gender and/or existing allergies of asthma. Personal cleanliness and habits are crucial to reducing exposure for remediation workers. In this picture right here, it shows mold behind kitchen cabinets from a leak in the exterior wall. Effect impacted by many factors. The effects of hazardous substances on health may depend on the chemical or material, what is it? The concentration, how much is it? The route of entry, how it's taken into the body, and the duration of exposure, how long the exposure lasts, and the sensitivity of the person involved. Health issues for workers. During mold remediation projects, workers could be exposed to other non-mold substances or hazardous materials that could cause adverse health effects, such as asbestos and lead-based paint, high levels of particulates, bacteria, which is associated with water-damaged materials, floods, and sewage backups, cleaning products, such as biocides used as part of the projects. And in this picture right here is showing insulation inside of wet wall from a flood, which does not dry out, with resulting in mold growth in the wall. Section 3 completed. In Section 3 we discussed the health effects of indoor mold growth, and you should now be able to describe the major respiratory health concerns regarding indoor mold growth, describe the major neurological health concerns regarding indoor mold growth, explain the involvement of the HVAC system to mold illness, and explain when gases are given off by mold and how these gases can impact health. More on health. Optional material. For more information, the latest up-to-date information on mold toxins and health, see article by course author Gary Rosen, PhD, called Mold Toxins and Related Illnesses. Cause and effect at www.mold/toxins.com. Mold and health review. Number 1. Illness from mold and mold remediation work can be diverse, including neurological problems, respiratory problems, and other. Which symptom is not a common mold-related ailment? That would be D, hair loss. Number 2. What are the 2 most common routes for mold exposure in the indoor environment? That would be A, inhalation, and C, skin. Number 3, respiratory symptoms from mold exposure are the most common problems from mold exposure. True or false? That is true. 4, pick 3 out of 4 allergic responses are most commonly experienced as. That would be allergic asthma, allergic rhinitis, which is hay fever, and allergic fungal sinusitis. 5, MVOCs are produced by growing molds and released into the air as a byproduct of mold growth, and often have strong and/or unpleasant odors. What does MVOC stand for? That would be B, microbial volatile organic compound. 6, personal factors can influence the effects of exposure to hazardous substances. Choose the best answer. That would be E, all of the above. Smoking and/or alcohol consumption, medication use, gender and/or existing allergic or allergies or asthma, or sensitivity, all of the above. 7, workers could be exposed to other substances or hazardous materials besides mold that could cause adverse health effects. Choose the one best answer. That would be E, all of the above. Because of asbestos and lead-based paint, high levels of particulates, bacteria associated with water-damaged materials, floods, sewage backups, and cleaning products, biocides, used as part of the projects. So the answer is E, all of the above. 8, neurological problems often found particularly in children occupying sick buildings, including both schools and homes, are E, all of the above. Behavioral and sleep disorders, lack of short-term memory, light sensitivity, and the inability to concentrate, which makes it E, all of the above. 9, what is the number one cause of mold-related illness? That would be A, mold on fiberglass-lined duct and supply plenum insulation. Mycotoxins. Choose all correct answers. Some, but not all molds can produce toxic substances called mycotoxins. That is correct. Mycotoxins can be on the surface of mold spores or in the mold stalks. That is correct. Hundreds of mycotoxins have been identified from common indoor molds. That is correct. And mycotoxins are best removed either by cleaning or disintegration by strong bleach. That is correct. And stay tuned for our next lesson, Section 4, Investigating Hidden Mold.